a very sad statistic. 7 out of 10 people are experiencing mental distress as a result of the COVID crisis. Now, on top of that, we are going into the holidays, which is going to mean additional stress. And to talk more about this important issue here on the Oakland County MegaCast, let's go ahead and bring in Jill Blackson. She's the Deputy Director for the Community Care Center, a nonprofit mental health agency. Jill, thank you for being with us on the Oakland County MegaCast.
Oh, thank you for having me.
Can we talk a little bit, before we start talking about the holidays, we have to talk about where we are right now as a community. And so many people are impacted in one way or another because of the COVID-19 and this crisis. When should someone understand it's just general stress and when they should seek help?
Yeah, and I think that even if you never experienced this kind of stress and anxiety before, if you had the quote normal kind of holiday stress, this is a game changer. This is different for everybody. And I think one understanding that we literally are all in this together, the entire world is can be helpful. But if your anxiety, if your stress is getting to the point where you're really having a hard time even functioning, then you need to reach out because help is out there virtually. So people do need to kind of check in with themselves and their family members and say, this is taking a big toll.
But with that, Jill, when you say it's impacting your life, is it small things that one person is noticing, or is this really something where you're not operating normally at all?
Yeah, I think really it's if you notice that, okay, it's maybe more than just, I'm feeling really down about this and this is wearing on me, but it's to the point that I'm struggling even getting out of bed. Or if family members are noticing that someone in their family or their friendship group even is really withdrawing, it's more than kind of like, yeah, we're all kind of, struggling with this and it stinks and it's rough. It's that, wow, you're really having a hard time. You are not functioning. You're struggling getting yourself to work. You're struggling getting yourself to maybe help your kids with their Zoom classes and things like that. If it's getting to that point, and I would say, even if it's not, even if you just need to kind of process this with somebody and talk it through, reach out and get the help before it gets even worse for yourself.
That's such an important thing that you just mentioned right there, is before it gets worse, because I will say, I think prior to the pandemic, mental health was a subject that we didn't really want to touch on, or there was a stigma attached to it. But I do think hopefully one of the good things to come out of this crisis is that it's okay for us to talk about mental health now.
Yeah, I think that's really important. We look at our physical health and our mental health so differently, and we really shouldn't. You would probably not have a whole lot of shame of telling somebody that you're diabetic or that you have some heart conditions that you're working on and getting treated for. But for some reason, when it comes to our mental health, we look at it differently, and we even put that stigma on ourselves, and we think that we should just be able to kind of tough it out and be able to handle it. And that is just not the case. Sometimes we need some help, and there's no shame in that, and you don't have to suffer. And I think that's really what I like people to know and to hear, is that you don't have to suffer. You don't have to suffer through this. You can get some help to get some coping skills to be able to manage this tough time.
So when you say get some help, can we talk about what kind of help is out there and available?
Yeah, well, I know even for us, so anyone can call Community Care Services and we can get you in to see a therapist virtually. So you don't have to leave your home. You don't have to, go out if you're uncomfortable doing so. But there's lots of agencies that now are doing that same thing. That during this time, we didn't stop our services. We knew people still needed to see their therapist, or if they need some help with housing and food and things like that, we have our case managers that can assist with that. If you're looking at possibly taking some medication, we have psychiatrists available that can also, do an assessment and prescribe that if that's something that's needed as well. So you can do this virtually, and I think that's new for a lot of people, but they can do that. And, I think at first we're all kind of a little hesitant to do the Zoom virtual thing, but we're all a little bit more used to it now in some way. And with smartphones, you can do it right through your phone as well.
So we talk so much about the hospitals being overloaded. and the healthcare workers being stressed out because of the COVID caseload. Is that the same scene that's kind of playing out in your world as well?
Absolutely. I have so much respect for all these, essential workers that are out there. But, our staff are essential workers, and our staff, all day long, 5 days a week, are helping and doing everything they can to help other people's mental health. And we make sure that they are taking care of their own as well, because if we know the toll it takes, even listening to the news and hearing all these stories, imagine as someone who's in the mental health field, hearing all these, taking on everyone else's, feelings as well. And they have to make sure they're taking care of themselves. So yeah, it's taking a toll on them as well.
But Jill, why do you think as a community, we're not talking about that more? We're not talking about the people on your side of this pandemic. We hear about the people in the hospitals, and we're hearing about the workers in the nursing homes, but no one's talking about the workers in your field.
Yeah, I don't know. I think that, again, I think some of it is that we just don't talk about mental health in general. It's kind of one of those things that people might to their close friends say, yeah, I'm seeing somebody. So I think in general, it's just a field that, doesn't get probably the recognition, and I might be a bit biased, but doesn't get the recognition that it deserves. Our staff are dealing with people who are really struggling, and we're struggling before this with some severe mental health issues, and now that's just been, gotten bigger for them during this time. And children as well. We have children that we see also, and they're at home, and they need to see their therapist and get their help too. So I think it's just one of those things that in general we don't talk about our mental health. So I'm glad that we have venues like this to say, hey, if we've learned, like you said, anything, we need to take care of our mental health as much as our physical health. So hopefully that message will come out.
So you had just touched on about kids. What signs should a parent look for with their kids during this pandemic?
Yeah, I think similar what you would look for in adults. Are they withdrawing more than normal? Are you seeing changes in their sleep patterns and their eating patterns? Are they more irritable than normal? Things like that. But, people sometimes are afraid to come out and ask their child, how are you really feeling? Are you even, are you thinking about hurting yourself? If a parent's that worried, they should ask that question. They shouldn't shy away from doing that because, again, there is help out there for these kids. And I think just kind of sitting down and checking in with your child. How are you doing? Are you staying in touch with your friends? Because, they've lost a lot of those social, outlets that are important. So I think just kind of if you see a change in your child, your child, ask them. Don't be afraid to ask.
I'm thinking about teenagers in general where they go, yeah, no, So you're right, yeah. But are you seeing an increase of kids and teenagers that need help right now because of this?
Yeah, I think overall everyone's anxiety has gone up, but when you have a child who's really their whole world is upside down, or maybe for them their safe place was actually at school because there's stuff going on at home, we have a lot of concerns about what's happening at home with these kids, with possibly the people that are causing some of their issues. So to be able to have that touch base virtually with their therapist is so important. But yeah, we have seen, if you have a kid that already was struggling maybe with some anxiety about going to school, think about how hard it's going to be for them to go back. If they were already struggling with their friends and social outlets and things like that, and that's completely gone, it's going to take a toll on anybody, for sure.
Yeah, and there is such a big concern about the long-term impact this is going to have on our kids and their recovery time as well. And so these conversations are so important to have. But are there avenues available to people who maybe can't afford a therapist, or they're, I don't know how it really works with a lot of insurance agencies as well. But again, there's that stigma attached to mental health.
Yes. And, most of all of your insurances now have some sort of benefit for therapy or for behavioral health services. And if you can't afford it, most places have, and we do too, a sliding scale fee so that we can make it affordable. We have a lot of clients who are on Medicaid. All they have to do is call, and that is a benefit that is covered for them as well. So it is out there. I always tell people, if you're not sure you have that insurance card, call that number on the back of your card. That customer service number, they will direct you. But most people do, in fact, all should have some sort of behavioral health benefit. Just call and find out where you can go and definitely access it. And people can call us and we'll help them with that as well.
Jill Blackson with us here on the Oakland County MegaCast. She's the Deputy Director for Community Care Services. Jill, can you tell us a little bit more about your organization? How do you operate? I know that you're a nonprofit, but what's your world like?
Yeah. So we're a community mental health clinic. So as I mentioned, we primarily service the Medicaid population, but we do take private insurances as well. We are in Wayne County, we're in Lincoln Park, and we have sites in Taylor as well, although we are virtual. So, our clients are those that have been, screened and identified as having a mental health struggle. And we see them for therapy, for group therapy, for case management services, like I mentioned, if they need help with housing and food assistance or helping with various benefits. And then also for psychiatric support. And a lot of our work is in the community. So while we have pulled back on that, we still do have case managers going to people's homes, obviously with the appropriate safety precautions, and seeing what they need and helping them get what they need, even before all this, but definitely, now as well.
So your industry was overwhelmed prior to the pandemic, and now even more so with that. But I do hope that with this conversation, more people are looking to go into your industry. Yeah. How is it with staffing for you?
Okay, so this is a big issue for us. It's not a glamorous job and you will not become rich. You really do have to have a calling to help people. And those are the people that we want. And those are the people that generally go into our field. But it is a low paying field. And we do, look for added support so that we can increase what we can pay our staff. But right now we are short staffed. And I think a lot of agencies like us are as well, to try and find people who want to do this work and have a calling and then be able to pay them something that is, equivalent to their schooling and their worth is a struggle for us. So we do advocate to do what we can to get additional funding so that we can hire the staff that we need to do this really important work.
So what are the educational qualifications that you look for, and what is the starting pay? 24, 25,000 maybe?
Well, it does depend, and we do have a set salary scale that we follow, but it does depend. So you can have someone that comes in at a bachelor level and with very little experience that could, maybe start out around 28. I can't say for sure because we have a formula that we have to follow that depending on your experience and your education. But we have staff that have, let's say, a bachelor's in social work. We have staff that have a master's in social work. We have case managers that also have bachelor's and masters. It just depends on what their preference is in terms of what they want to do with that degree. We also have staff who are psychologists. So you have your bachelor's and, your psychologist, and we have staff that have a degree in a human service field that can work in certain positions within our agency also. And then, of course, your doctors.
Right. And you look at this and you're like, but when you have a need due to a situation such as this, a spike in cases because of a pandemic, it's not so easy to just fill in that staffing need like someone at a retail store or a bar or restaurant may be able to do.
Right. And, we have to have, because of the work we do, you have to have a certain level of training, and everybody wants that. And so we do have to look for people who have the experience and the training in working in this field. And I'm not real sure if it's, something that people always look at as something that can be as rewarding as it is, because it can be very rewarding. And so I think that's part of the advocacy work that we do, is say that, yeah, it's tough work, but there's lots of tough work out there. But if you want to make a difference, and you're not someone who maybe wants to do that on the medical side, you can do it on the behavioral health and the mental health side. So me, I probably couldn't work with blood, but I like talking to people and I want to help people. So if you have a passion for wanting to help somebody, this may be a field for you to explore.
That is a great thing. With that, quickly, because I had a girlfriend who went into this, and then once she graduated, She lasted 6 months. It was too emotionally draining for her. So it takes the right person as well.
Yes.
What is the status of your internship policy at the time during a pandemic?
Yeah, well, we are open to taking interns, and we have contacted the universities that we've worked for and said we will do it virtually. We have to have staff on site who can mentor and be the liaison and the support to those interns, and we do have some staff that will do that. But I know it has been a struggle for the universities to place interns because that hands-on experience is so important, but we're doing what we can to make it work.
Yeah, and you want to foster that environment to try to get more people into this industry. Just about another minute with you before we let you go, Jill. Anything we didn't touch on or mention that you think is important to get out to the listeners and the viewers?
Well, I think we covered it. I just really want to emphasize that, one, don't worry about the stigma. Taking care of yourself is always important. And if you don't have to suffer, I think people are suffering out there, and that makes me sad because they don't have to. It doesn't have to be years and years of therapy. You can reach out, get some help, and get some relief.
With that, what areas do you service?
We are in Wayne County.
And do you want to give out the information on how people they can connect with you if they need to?
Yes, they can call us at 313-389-7500. Or they can look us up on our website at comcareserve.org as well.
Well, Jill, thank you so much for being with us here on the Oakland County MegaCast. We so appreciate your time.
Oh, thank you for having me. I really appreciate it.